She's making sounds.
That's Willa, almost 4 months old.
Hi, sweet girl.
Born November of 2020, and when her mom, Stephanie Russo, got home from the hospital, she figured her sore throat came from yelling during labor. But after she lost her sense of taste and smell, she knew.
Our first outing as a family of 4 was to drive over to the COVID testing center, which is just, ridiculous.
Russo tested positive. So did her husband. Their toddler, Doc, got sick a couple days later. They believe the baby had COVID too, at just 4 days old. And that's not all.
I don't know how many of the nurses, but I know it was at least a handful of them also caught it.
So it was you, Nick, Doc, Willa, the doctor who delivered Willa, at least a couple of the nurses, your mom and your dad?
Actually, now that I say that, when Willa was 2 days old, I had to take her to the pediatrician, and this is before I had been tested. The nurse, who's actually quite a good friend of mine, also caught it.
Russo spent the first 3 weeks of Willa's life sick in bed, wondering what this might mean for her newborn and for herself.
It was a very frightening time. It was a really hard way to introduce a new member to the family.
So many pregnant women and new moms are grappling with similar kinds of questions about how safety and stress in the age of COVID affect their kids. Questions I definitely understand.
This is a ball.
As a pandemic mom myself.
If you're happy and you know it, clap your hands.
Monroe was born just a week before the world shut down last March.
I feel the anxiety that comes with just generally being a first-time mom on top of the incredible stress of living in a pandemic and trying to stay safe.
I mean, we're hearing that across all race, ethnicities, all socioeconomic groups. The levels of anxiety are really higher than anything we have ever seen before.
Laura Jalif-Pawlowski leads a study on pregnant and nursing women at UCSF, finding this winter 60% of women had so much stress it affected how they functioned, and different communities felt it in different ways.
There are pregnant women among us, women of color in low-income communities who were already at increased risk of adverse outcomes. This was just one more thing on top of them.
Talking about the mental health impact is the first step. Dr. Mati Shlachwayo-Davis understands what stress is like as an infectious diseases doctor and a mom of 2.
I was 7 months pregnant when the pandemic broke. May hits, I'm about to have my baby, and the statistics around Black Maternal Fetal Health Week hit. So I'm bombarded with the statistics that say people that look like me will die at higher rates than white women. And then 2 weeks after that, I had my baby girl. 2 weeks after that, George Floyd died.
She knows she's the best mom to her children, but even she struggled at times with the guilt so many working moms feel.
Wellness and mental health support, specifically in communities like mine. This has to be normalized.
There is a stigma around some of this discussion about how hard it is to be a mom, especially a mom in a pandemic, and that we can't just self-care our way out of it.
You are not an island, and it's a very toxic idea to put the burden of getting through this alone. You cannot pour into other people from an empty cup.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.